Hi, my name is Agnes Montgomery, and my evidence based education innovation project is improving cultural competency in nursing practice. This idea arises from the fact that the healthcare system is accessed by people from a varied background like gender, age, education, economics, political, social, technology, and the list is long, who interact with each other daily. These people must work together to improve the nursing care being provided. Nurses are people and they bring with them their own uniqueness in knowledge of their profession and their own biases. This project intends to have all these differences to be in the fore for that individual nurse and nurses collectively when they are acting in their professional capacity. The client in most cases for the nurses will be the patient, and this would include the family and friends of the patient. This project acknowledges that a lot has been said and done about diversity in nursing, and diversity is actually included in the nursing curriculum with the individual subjects. This innovation is advocating for a 3-hour lesson devoted strictly to addressing the different diverse issues that are encountered during a nursing experience. This project is implemented with the first year associate degree in nursing students. The setting of this project is in a simulation lab where there is a lab or any other venue that can be transformed to meet the purposes of the lesson. This project has created 3 unfolding case studies which will be posted for the students to familiarize themselves with before class. They are unfolding or revolving because the instructor can guide the students if need be during the actual simulation. On class day, the students will meet for a briefing session about 10 minutes. The students are then given roles to perform during the simulation, and the simulation itself should take about 20 minutes. The students meet again for a post simulation conference where they share their experience as to what they did well, what they need to improve on, and what improvements the simulation scenario can benefit from. And this will take about 15 minutes. The next 15 minutes or 5 minutes would be for break at whichever part of the 1 hour the students like, and the next 10 minutes will be for students to share their diversity stories, at least 1.5 minutes for each student in a class of 6 students. And this will be repeated for the next 2 case studies. And through all this, the project is getting assessed by the students' feedback, and there will be a 10 question test to just test the knowledge of the students. even though all this will be taken care of during all these discussions. And the theory that guides this project is the cognitive theory. I use the social cognitive theory and the cognitive learning process theory together here. This is because human beings live in a social setting and diversity arises from these settings. One needs to recognize the different situations one can find themselves in and adapt to it to provide the most effective evidence-based care there is at that particular time. The nurse should be able to identify any possible barriers to care that could be related to the patient's social background and even the nurse's own biases. This theory is appropriate as it allows the experiences to be replicated when the situation arises. My intended outcome with this project is to produce nurses who are culturally competent in caring for patients in all situations and who are able to manage their own biases as they provide care. This project is not to take away from the already existing cultural integration into the subjects. It is to add to it with specific emphasis to culture as it affects nursing care. It is emphasizing on the different aspects of diversity that are encountered in nursing that affect nursing outcome. Thank you.